Good evening, everybody. Thanks for coming. And thank you, Mary, and thanks to the library and to the Chicago Public Library Foundation for hosting tonight's event. It is a pleasure to be here at Harold Washington Library, one of my favorite places in Chicago. It is both an architecturally grand symbol of learning and a practical place to find books, conduct research, and attend lectures like this one. It is also a place where Chicagoans come together from all parts of the city. Mary mentioned the MacArthur-supported U-Media space. You may have noticed it as you walked into the building, a place for teens to learn together after school, assisted by skilled librarians and using digital technology. This is the latest incarnation of MacArthur's interest in libraries. A very early one was support for a collection of high-quality videos, the MacArthur Video Classics, prepared for libraries around the country when educational videos were too expensive for individuals to buy. It's hard to remember back that far. Later, libraries were the first concern of our work on intellectual property in the public domain in the digital age. As we at MacArthur think about the future of education, media, and technology, we always come back to libraries. This lecture series was conceived as part of Science Chicago, the world's largest science celebration, which MacArthur helped develop and plan. Our interest in sponsoring that program came from our desire to recognize the important role that Chicagoans and their institutions have played and continue to play in scientific advancement. It was our hope that some of the 140 institutions participating in Science Chicago would continue their public programs after this actual year ended, and this lecture is one example that is taking place. But some of you may not be here because of your deep interest in science. Some of you may be here because we are all interested in our health. Today we get to meet and hear from Dr. Regina Benjamin, Surgeon General, and someone who is concerned about the health of all of us. Dr. Benjamin is the 18th Surgeon General of the United States Public Health Service. As America's doctor, she provides the public with the best scientific information available on how to improve our health and the health of the nation. Dr. Benjamin also oversees the operational command of 6,500 uniformed health officers who serve in all locations around the world to promote, protect, and advance the health of Americans. Dr. Benjamin became Surgeon General in 2009, an incredible honor filled with responsibilities. But the year before, in 2008, she received another honor when she was awarded the MacArthur Fellowship, recognition for the creativity and impact of her work, with no strings attached. This is how the foundation described her at the time of the award. Regina Benjamin is a rural family physician forging an inspiring model of compassionate and effective medical care in one of the most underserved regions of the United States. In 1990, she founded the Bayou Labat Rural Health Clinic to serve a Gulf Coast fishing community in a rural village of approximately 2,500 residents in Alabama, a village devastated twice in the past decade by Hurricanes George in 1998 and Katrina in 2005. Despite scarce resources, Dr. Benjamin painstakingly rebuilt her clinic after each disaster and set up networks to maintain contact with patients scattered across multiple evacuation sites. She established a family practice that allowed her to treat all incoming patients, many of whom were uninsured. Benjamin is skilled as well in translating research on preventive health measures into accessible, community-based interventions to decrease the disease burdens of her diverse patient base, which included immigrants from Vietnam, Cambodia, and Laos. With a deep first-hand knowledge of the pressing needs and health disparities afflicting rural, high-poverty communities, Dr. Benjamin is ensuring that the most vulnerable among us have access to high-quality care. Who could ask for a better prepared Surgeon General? Please welcome the 18th Surgeon General of the U.S., Dr. Regina Benjamin.
Wow, thank you for such a warm welcome. I am really honored to be here, and thank you, Ms. Revere and the MacArthur Foundation. What she didn't tell you is that with the MacArthur Award, they start calling me a genius, and so I'm still waiting for that. I'm waiting for that smartness to happen. So, to Commissioner Mary Dempsey and all of you for coming out. Good friends, I see some very good friends here, and my sorority sisters of Delta Sigma Theta. Thank you for being here. I really thought I would start this evening just by sharing with you how I got involved in organized medicine. Let me know if you can't hear me. I'll pull this microphone up. When I was an intern, I attended the Medical Association of Georgia's annual meeting, and one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. Well, I stood up in a room with maybe 20 people, and I thought, you know, I told them I had never seen certain diseases or illnesses except in a textbook, and the resolution passed. So the Georgia delegation sent that resolution and forwarded it to the AMA here in Chicago, and they sent me to speak to the same issue. The resolution passed, and within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference, whether it's in medical policy or in medical practice. And I learned that I could make a difference in medical practice when a National Health Service Corps sent me to Biola Battery. It's a pretty place, but it's a poor place. I found a community of working poor, too poor to afford medical care, but too rich to qualify for Medicaid. I liked the people, I liked the community, and I wanted to practice medicine there. But I quickly learned that practicing medicine wasn't just sewing up the shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape dispensers, and all that paperwork that goes along with it. And so I decided to stay involved, and stay involved in every organization I could, the AMA, the Academy of Family Physicians, our medical societies, the Red Cross, United Way, Girl Scouts, Chamber of Commerce, any organization that I could help get services to my community. I also found that my patients had problems that my prescription pad by itself wasn't going to take care of, especially things like adequate housing, like after Katrina, clean water, clean air, employment opportunities. And so I had to stay involved. I had another number of patients. I had a couple of patients, one patient, Donna. Donna's a young white girl in her mid-20s, and she had seizures. And so I said, Donna, you know, how have you been? And she started having seizures again. I asked her why. Had she done anything different? So the patients draw or write down notes for me so that they won't forget when they come to see it. And she had drawn for me her pills. One used to be striped with 2 colors, and now it's solid. And I learned that Donna couldn't read. And it didn't matter how much I wrote prescriptions, we needed to get adult literacy program in our community. And she wasn't the only one, but 20-something years old and couldn't read in today's world. I also had a patient that I like to talk about, call her Miss Smith. I have to catch myself so I don't say her real name. She called me on a Saturday, and Ms. Smith is about 42 years old or so, about that high, African-American woman who works at our school system in the janitorial department. And she called me on a Saturday, and she said, you know, Dr. Benjamin, my back is really, really hurting. The medicine that ibuprofen is not helping. Can you call me something in stronger? She says, I went to see that specialist you told me about. He told me to lose some weight, and I'm trying, I really am. But can you get me something stronger? And I could hear the pain in her voice. And I said, sure, I can call you in something stronger. Today is Saturday, but you're going to have to come see me on Monday or Tuesday. Sure enough, on Tuesday, I walk in the exam room, and she was there, leaning over the exam table in so much pain she couldn't sit down. And I said, Mrs. Smith, you know, did the medicine help at all? She says, well, Dr. Benjamin, I didn't get it. What do you mean you didn't get it? She says, I couldn't afford it. I said, but you work at the school system. You have Blue Cross. She says, I know, but I didn't have the copay. But I get paid on Friday, and I promise you I'll get it Friday. And I said, I'll be right back. So I went out of the room and had my nurse Nell go across the street and ask Jim to get her medicine. So I came back in the room, gave her medicine, and said, Mrs. Smith, you really should be taking your medicine. You're obviously in a lot of pain and you're hurting. I want you to have your medicine. And at that moment, her eyes welled up with water, and she said, oh, Dr. Benjamin, I'm so embarrassed. I didn't want you to do that. And I realized at that moment I had taken her dignity from her. Cultural competence doesn't have anything to do with the color of your skin. It has to do with you allowing people to keep their dignity. And so I had to figure out how to get out of that. So I told her about the fact that, you know, we have these small pots of money. People have been donating for situations just like this. And so, particularly after the storm, people had sent us funds for that. And she was okay, and I told her she could pay it back on Friday if she wanted to, but she didn't have to. And so she was all right with that. And as I was walking out of the room, I said, she says, oh, by the way. And the oh, by the way, most of our doctors know, means something else. We don't know what it's going to be. But in her case, it was, oh, by the way, can I get a work excuse? And I said, sure, today is Tuesday. You want to go start taking your medicine and go back to work on Thursday or Friday? She says, oh, no, we have to strip those floors tonight. Here is a woman who cannot sit down because she's in so much pain, but she's willing to strip the wax off of the floor so our kids can go to school in a clean environment. She and those like her are the reasons that we advocate, and we're there to be their voices and to be able to help them in any way that we can. And it's the reason I fight for her and others like her. And so it was really with mixed feelings that I left my patients in Biobattery to go to Washington to take this job. But I felt like, I tell myself anyway, that I'm, you know, now I've opened a practice in D.C. and I have 300 million Americans as my new patients. So. And as was said to you, as America's doctor, I really want to provide Americans with the best scientific information available on how to live healthier lives. I also want to try to bring some clarity and understanding to that overwhelmingly confusing conversations that are going on now about health and health care. I really am especially grateful to serve at this historic time as we make these overdue changes on how we finance and how we deliver health care. Changes that will eventually give all Americans access to high-quality, affordable health care that they deserve. Giving Americans health care coverage is just the first step to truly reducing health disparities that plague our country. But we know that reducing and ultimately eliminating health disparities is going to require more than just giving patients an insurance card. We have to address the social determinants of health, such as poverty. You know, a study that was published in the December 2009 issue of the American Journal of Public Health showed that poverty and dropout rates are at least as important a health problem as smoking is in the United States. And we know how bad smoking is. On average, poverty showed the greatest impact on health. Smoking was second, followed by being a high school dropout, non-Hispanic black, obese, a binge drinker, and uninsured. The second step, and one that I feel is just as challenging, is prevention. Prevention is the foundation of our nation's public health system, and prevention is the foundation of my work as Surgeon General. And my priorities focus on wellness and prevention. The last year, actually in January, I joined Secretary Sebelius and the First Lady Michelle Obama at a press conference to release my very first paper, which was entitled The Surgeon General's Vision for a Healthy and Fit Nation. There's probably no more serious challenge to the nation's health and well-being than those posed by obesity and overweight. Since 1980, obesity rates have doubled in adults and more than tripled in children. And the problem is even worse among Hispanic and Native American children. More than, you know the statistics, more than 2/3 of adults and more than 1 in 3 children are overweight and obese. We see the sobering impact of these numbers in the high rates of chronic diseases such as diabetes, heart disease, and other chronic illnesses that are starting to affect our children more and more. Recently a study from the University of North Carolina School of Medicine reported that obese children as young as age 3 show signs of an inflammatory response that has been linked to heart disease later in life. And so I was really pleased to join the First Lady for the launch of the Let's Move campaign. Both my vision for a healthy and fit nation and the First Lady's Let's Move campaign take a comprehensive approach that engages families and communities as well as the public and private sectors. Because for years we've encouraged Americans to eat more nutritiously, exercise regularly, and maintain healthy lifestyles. My vision for a healthy and fit nation is an attempt to change that national conversation from a negative one about being obese and illness to a positive conversation about being healthy and being fit. We really need to stop bombarding Americans about what they can't have, what they can't do, what they can't eat. We need to start talking about what they can do to be healthy and be fit. But in order for people to be healthy and be fit, these things really mean that Americans need to live and they need to work in environments that support their activities and their efforts. There's really a growing consensus that we as a nation need to create communities and environments where the healthy choices are the easy choices and the affordable choices. I've actually been trying to do a little bit of an example for that by doing some walks around the country. We started with a walk in Baltimore and walked around the harbor, just walking. We started walking around the harbor, and people who were having lunch started to join in. They pay their bills, start joining in and walking with us. We walked in Los Angeles with the mayor and 5,000 fitness trainers, and we've done some Martha's Vineyard, and we're going to walk with the doctors at Harvard this Thursday and Nashville next week. And another part I won't call a walk. It was a little more than a walk. I hiked the Grand Canyon rim to rim, which was 26 miles, and 5,000 feet down, and then had to go back up 5,000 feet. But I had I went with some friends, and I had a camera crew following me. So you're walking out of breath, and you see a camera on you. So it was one of those things. But the whole purpose was to say that, I'm not an athletic buff or anything, but if I can do it, anybody can do it. And it doesn't take a lot to walk. You just walk, have fun, and enjoy. And the same thing, you can do it in your community. The whole purpose is to make sure you're having fun, having a good time, dance, play, double Dutch jump rope, whatever it is, just be enjoying being healthy and being fit, no matter what size you are. And so that's really the idea behind the positive part about being healthy and being fit. My priorities really, that's one of them. They're all about prevention. I'm a family doctor, so I couldn't settle on one. I like everything. So obesity is one of the issues. And when we talk about obesity, we have to talk about breastfeeding. In our country, we don't breastfeed nearly to the rates that other countries do. And so we know that exclusively breastfeeding a child for the first 6 months of life, that child is less likely to become obese. And so we have a paper coming out with the science behind that very soon, in the next few months. Smoking and tobacco is still a big problem. They're basically targeting our children. The teenagers are really what we're being marketed to. So we really need to be doing things, and you'll hear more tomorrow about some of the things we're trying to do to make kids not want to smoke and to encourage them not to smoke. HIV/AIDS is still a major problem in this country, particularly with women and girls. People are dying from it. We tend to think that because we have drugs now to treat HIV, that people aren't dying, but still people are. And there's a new documentary out called The Other City. It's about HIV/AIDS in Washington, D.C., and the rates of HIV infection there is higher than some sub-Saharan countries in Africa. Another area is mental illness and mental health, substance abuse. This summer I spent a lot of the time along the Gulf Coast addressing the behavioral health effects of the Gulf oil spill, and we're still dealing with the effects of that, the behavioral health effects, the depression, the sadness, and we even had gentleman in our area to commit suicide. So it can be very serious when you have a major effect on your community. Violence, and I don't have to tell you in Chicago that violence is a major, major illness that's affecting our communities. It's at a public health level, particularly youth violence, gender violence, domestic violence, violence in the workplace, and just plain random violence. And we have to treat it as a public health approach to overcoming the violence. And of course, eliminating health disparities is another area that we have to eventually just eliminate. You know, people often ask me what they ought to call me. Should they call me general? Should they call me surgeon? What do they need to call me? And I actually prefer to be called doctor. But while my formal title is Surgeon General, the rank on my uniform is actually that of a 3-star admiral. And that's because I lead the United States Public Health Service, which was begun as a service to provide care to merchant marines. The uniform is modeled after the Navy as a tribute to public health's nautical roots. The Public Health Service was started and created in response to a deadly outbreak of yellow fever that devastated the people of Philadelphia back in 1793, when the city was serving as a nation's temporary capital. The epidemic killed about 10% of the city's population and drove out a third of its residents. It was unknowingly brought to Philadelphia by the merchant sailors, who at that time were a vital part of the free flow of commerce that was the lifeblood of our young country. As a result, then President John Adams signed into law a bill creating a national system of hospitals to treat the merchant marines. Some of you may even remember the old public health hospitals. Today, I command those over 6,500 commissioned officers who administer health programs across the country and abroad. We also provide health care to people in health clinics, Indian reservations, and federal penitentiaries. I tell you all that about the Public Health Service because I'm proud of the Public Health Service, but also this is an example of what a strong leadership from a president can do to address the acute health care issues and needs of a country. And that's what President Obama was doing and still is doing with the health reform and the Affordable Care Act. The Affordable Care Act provides this historic funding and a funding commitment to promote prevention and wellness. So I'll always come back to my prevention and wellness. The new law established a National Prevention, Health Promotion, and Public Health Council, which I have the honor of chairing. The members of this council include cabinet-level heads of agencies throughout government, not just HHS, but throughout government, which kind of signifies the significance of this council. And the council is going to provide coordination and leadership at the federal level to ensure that government is focused on prevention. We're going to develop the first ever national prevention strategy and make recommendations to the President and to Congress about the most pressing health issues affecting the nation and changes in federal policy on how to prevent those problems. So with this council, I really hope to move us from a system focused on sick care to a system focused on prevention and wellness. Because as a family doctor, I, just like many of you, have seen so many missed opportunities for prevention in healthcare settings across this nation. If we really want to truly transform and reform our health system in this country, we need to prevent people from getting sick in the first place. We need to stop the illness and stop the disease before it even starts. So in addition to the state-of-the-art medicine that we have now and we need to continue and to nourish, we also need to have a new approach to promoting this prevention in our communities. Because staying healthy depends on other factors that influence our health, like housing, transportation, education, the availability of quality and affordable food, our workplaces, and our environment. I really want to change the way we think about health in this country, and that calls for us to have a nation to take a more holistic approach to community health. Everything from safe highways to safe work site and wellness programs, to clean air and healthy food. We really want to get to a place where everybody understands that almost everything we do, even though it's not labeled as a health or prevention, really does affect the health, quality, and length of life of all Americans. So this is really an exciting time to be in healthcare and an opportunity to make our health system work better and easier for the patients we serve. And before I end, I really want to talk about one other thing, and that's a little bit about leadership. And just tell you two of my leadership styles that I like. One you really know about, everybody knows pretty much about the servant leader who gets things done by serving. That's how they lead. They just, not for the glory, not for the fame, just by doing it because it needs to be done. My example of that is my grandmother. She did a number of things, but one of the things she did was when my mother was and her twin brother were children, they had to sit in the back of the church, in the back of the Catholic Church, because that was the way things were in the South. So my grandmother got some property donated and started a church for blacks. And she didn't have to, she just did it. And that church now, I went to Mass there a couple of weeks ago on the evening, and I think I was one of two blacks in that particular Mass. It becomes full circle. It's completely integrated. But with that church was a priest and some nuns came over and started having these, we call them lawn parties, to raise money to help build a church. And the sisters were introduced to that side of the bay in Mobile, and they started what was called it was a nursing home. We called it Villa Mercy, but it was a nursing home. And that nursing home became the only inpatient hospice in the country. And so as a few years back, I got on the board of that nursing home, and I had been my picture had been in the paper, and I'd done some other things. And my mother called me, and she says, "Regina, you must be really important. You're on Villa Mercy board. None of the other stuff mattered." It's community. It's when you're doing something in the community. But as a result of that, I did become a part of Catholic Health Association and other things. And so if my grandmother hadn't just started that church, I probably would have never done a lot of these other things, and we wouldn't have the community that we have now. And the example for most of you to think about for servant leadership just by doing something because it needs to be done was back in 1871, after the Great Chicago Fire, and A.H. Burgess from London started the English book donation to provide a free library for this burnout city. And just by sending out a few little requests to English society, they collected 8,000 books. And as a result, we have today one of the largest library systems in the United States and one of the more successful ones, and that's why we're here today, because of somebody just seeing that something needed to be done. The other leadership style that I like is, I made it up, but it's called leadership from behind. I call it leadership from behind. And that's when you rise to a level of success that you don't forget to reach back and pull someone else up with you, that you remember that they too can come up. But a strong leader doesn't stop there. A strong leader, speaking of leaders, I see some of my Kellogg Fellows leadership program here in the audience too. You don't stop by just pulling them up. You also push them out in front of you and make them become even better leaders than you were. And you also let them know, like the young people say, you have their back. That if they start to stumble or fall, that they'll know you're there to catch them, and they're not going to fall because you're behind them. So that leadership from behind is a stronger type of leadership. One of the things that I always talk about in healthcare is that we need to encourage minorities to go into health careers and to health professions. Less than 6% of the nation's physicians are minority, whereas 30% of the population is. The same thing with nurses and dentists. So if you see some young kids, encourage them to go into sciences just to get them the idea of being started. You never know who's watching you. I learned that all this stuff wasn't about me when I used to get my names in the paper and I'd be on a magazine or something, and a reporter would call and say, well, can I interview you about the same thing that was already written? So I thought it was, annoying because I wanted to see patients. Until one day I got an envelope in the mail, and it was a manila envelope filled with letters from a third grade class. And every one of the letters says, I want to be a doctor just like you. Now, whether one of those kids became a doctor or 10 of them, it didn't matter. Those articles weren't about me, they were about them. And so I've been answering reporters from then on because I really understand that it's about them. You really never know who's watching you. When I was on the AMA Board of Directors, I was the first person under 40, but also the first African-American woman on the board. And so actually it was here in Chicago, over at the Hyatt, where we were meeting. And during that meeting, the board would meet, and then the full AMA House of Delegates would meet. And I went back to the boardroom to get something off my table that I left, and there was an elderly man, a janitor, who was cleaning up. And he turned to me and says, ma'am, can I ask you something? I said, sure. Or he says, well, can I say something to you? I said, sure. He says, I want you to know we're very proud of you. I know you're here, the ladies in the kitchen. I even told my daughter about you. You never know who's watching you. And I had no idea that they even knew that I was in that room, but they did. So with that comes a certain responsibility to make sure that we do well and set good examples. If I were not your doctor, I wouldn't be telling you this, but as your doctor, I have to say, take time to take care of yourselves. Make sure that while you're being leaders in your communities, that you look after yourself. Take time to exercise, to have fun, to enjoy yourselves, because if you burn out, you're not going to be any good for anybody. If you have a heart attack and die, you're certainly not going to be any good. But to make sure that you take some time to take care of yourself. And because it's flu season, I want to make sure you take your flu shot as well. Because on the plane last night when I came here, the stewardess said, put your own face mask on before attempting to help others. You really do have to take care of yourself. And finally, I'm going to end with a little story about which some of you probably heard, but there was a young girl who was jogging along the beach early one morning, and as she was taking her run, there was a older gentleman who was tossing these starfish in the water. And as she did her run, she see him tossing these starfish. And finally, after she finished her run, she couldn't take it anymore, so she went up to him and she says, why are you tossing those starfish in the water? There are hundreds and hundreds of starfish along the beach. As soon as the sun rises, it's going to dry them all out. They're going to die anyway, and it's not going to make a difference. Why are you bothering? He looked at her, reached down, picked up a starfish and said, because it'll make a difference to this starfish. And he tossed it in the water. So as you go out, make sure you find your own starfish and continue to make a difference. Thank you so much, and I'm glad to be here. All right. Thank you.